Welcome to another episode on Vantage at I Want Second Opinion. This is Dr. Raj Prakash. To know how to seek free medical second opinion in spine or in orthopedics, kindly go to the YouTube homepage of I Want Second Opinion. Further to our 4-part series on running so far, today we shall touch upon a topic that's crucial for every runner's journey. 10 common running injuries in brief and 5 strategies how to possibly prevent them. Running is one of the most accessible form of exercise, but it is not without risks. Whether you are a seasoned runner or just starting out, running injuries can derail your progress and can cause unnecessary pain and frustration. However, with the right knowledge and precautions, many of these injuries can be prevented. First, let's talk about the impact running has on our bodies. Running is of course a high impact activity that puts stress on our muscles, joints and bones with each and every stride. While this stress is essential for building strength and endurance, it also increases the risk of injury if not managed properly. Now, let's look into the common running injuries. Number 1, runner's knee. Number 2, shin splints. Number 3, plantar fasciitis. Number 4, Achilles tendinitis. Number 5, iliotibial band syndrome. Number 6, stress fractures. Number 7, muscle pull and tear. Number 8, ankle sprain. Number 9, blisters. And number 10, temperature related injuries. Now, we shall briefly touch upon these injuries as to why they are and what they are, and very briefly we shall mention about the broader aspect of the treatment. If viewers are interested, I will be able to come out with videos addressing in specific conditions in elaborate and the treatments upon request, which you can kindly mention in the comment section below. Now, let's go briefly into the specific common injuries. Number 1, runner's knee, otherwise called as the patellofemoral pain syndrome. Patella is the kneecap bone and femora is the thigh bone. The place where the kneecap bone glides onto the thigh bone is the patellofemoral joint. This is characterized by pain around behind the kneecap, and it is often caused by overuse, improper running form and muscle imbalance. Treatment may include rise, ice, compression, elevation, physical therapy to correct muscle imbalance, and in severe cases, surgery. Number 2, shin splints, otherwise called as the medial tibial stress syndrome. Shin splints results in pain along the shin bone, which is the tibia, otherwise called as the leg bone, and they are typically caused by overloading the muscles and tendons in the lower leg, often due to increased in training intensity or improper footwear. Treatment once again involves resting, ice, stretching, strengthening exercises and modifying the training routine. Number 3, plantar fasciitis. This is inflammation of the plantar fascia, which is a soft tissue structure known in the heel of the foot. This band of tissue that runs along the bottom of your foot gets inflamed, resulting in heel pain. It is often caused by overpronation, tight calf muscles and wearing unsupportive shoes. Treatment may include once again rest, stretching exercises, orthotic inserts, night splints, physical therapy, injections, shockwave lithotripsy, and lastly surgical intervention. Number 4, Achilles tendinitis. Achilles tendon, as we have discussed in one of our previous videos, is the strongest tendon in the body, which runs on the back of your ankle and the heel. The inflammation of this particular tendon is called as tendinitis, and coming to the word Achilles, it is the strongest tendon in the body as we mentioned. Achilles tendinitis is the inflammation of the Achilles tendon which connects the calf muscle to the heel bone. It is commonly caused by overuse, sudden increase in mileage or tight calf muscle. Treatment of course includes rise, rest, ice, stretching and eccentric strengthening exercises, and in severe cases may need immobilization or a steroid injection or surgical intervention. Number 5, iliotibial band syndrome. IT band syndrome involves pain on the outer aspect of the knee, and it is caused by inflammation of the IT band. This IT band, otherwise called as the iliotibial band, is a thick band of tissue that runs from the hip to the shin. The treatment once again includes RICE, which is essentially rest, ice, stretching, foam rolling, and addressing biomechanical issues through physical therapy or gait analysis. Number 6. Stress fractures. Stress fractures are teeny cracks in the bones of the foot or the lower leg and are usually caused by repetitive stress or overuse. Treatment, of course, involves rest, immobilization, and gradual returning to the activity once the bone has healed, which may take anywhere between 6 weeks to 6 months' time. Proper nutrition and addressing underlying biomechanical issues are also essential for recovery. Number 7. Muscle pull. A small tear in the muscle due to overstretching often causes a popping sensation. Treatment includes, of course, RICE, which involves rest, ice, compression, and elevation. This might take approximately 6 weeks to 3 months to settle down. Number 8. Ankle sprain. Stretching or tearing of the ankle ligaments commonly occurs when the foot twists or rolls inwards. Treatment is once again RICE, which involves rest, ice, compression, and elevation. Once again, ankle sprains, depending upon the severity, can take anywhere between few days to few weeks to 3 months' time. Number 9. Blisters. Fluid-filled sacs caused by friction between the skin and shoes or socks or even your trousers. The inner side of the thigh near the groin region can also develop blisters because of the sweating. Prevention involves gradual shoe usage, double-layered socks, and petroleum jelly. Number 10. Temperature-related injuries. These includes sunburn, heat exhaustion, frostbite, and hypothermia depending upon the place we are running. Prevention includes appropriate dressing, hydration, and sunscreen usage. Now that we have identified these common injuries, let's briefly touch upon 5 strategies as to how we can possibly prevent these injuries. Number 1. Gradual progression. One of the most important principles of injury prevention is gradual progression. Avoid sudden increase in mileage or intensity and give your body time to adapt to the demands of running. Number 2. Proper footwear. Invest in a good pair of running shoes that provide adequate support and cushioning for your feet. Consider getting fitted at a specialty training center and find the right shoes for your gait and your foot type. Number 3. Strength training. Incorporate strength training exercises into your routine to build muscle strength and improve muscle stability is paramount. Focus on exercises that target the muscles around the hips, knees, and ankles to prevent imbalance and also overuse injuries. Number 4. Cross-training. Mix up your workout with cross-training activities like swimming, cycling, or yoga to reduce repetitive stress on your muscles and joints. Number 5. Proper form. Pay attention to your running form and technique. Strive for relaxed posture, a slightly forward lean, and a quick turnover of your feet to minimize impact and reduce the risk of injury. In conclusion, while running injuries are common, they are not inevitable. By following these prevention strategies and most importantly, listening to your body, you can enjoy the many benefits of running while minimizing the risk of injury. Remember, consistency and patience are key on the journey to become a stronger and a healthier runner. Many thanks for watching the program. If you like the content, please hit the subscribe, like, and the notification button. Stay safe, stay healthy, and once again, thank you for being a part of IWSO family.